To recognize the importance of taking care of our hearts as part of self-care. Here to talk about decreasing your risk of heart failure is Dr. Andrew Scatola, a transplant cardiologist at Hartford HealthCare. Good afternoon. Thanks for being with us.
Good afternoon. Thank you very much for having me.
Great to have you. So what leads a patient to needing a heart transplant?
So people with specific types of heart failure, so their disease has progressed to the point where our typical medications are no longer sufficient to treat their ailing heart, may need what we call advanced therapies. Those advanced therapies can include continuous IV medication. It doesn't really fix the heart, but it can certainly make people feel better. Or they may benefit from a surgically implanted heart pump called a left ventricular assist device, or an LVAD, or even a heart transplantation. Our goal is always to try and recover someone's heart function first, but if we're unable to do that, or if somebody has really severe heart failure, then they may benefit for a heart transplant evaluation sooner rather than later.
All right, and we know you do a lot of them at Hartford Hospital. How can someone recognize when they're experiencing heart failure?
Sometimes that can actually be kind of tricky. The symptoms of heart failure can be very similar to many of the other diseases of the heart and lungs. Typically, the most common symptoms of heart failure are swelling and fluid retention, as well as trouble breathing. Usually, that swelling starts down at the feet and the ankles, and as people hold on to more fluid, that starts to progress up their legs and into their belly. Additionally, people first usually notice the trouble breathing doing activities that they used to have no problem with before, and then they start to notice that they can't do these things the way they used to be able to. That trouble breathing can progress to the point where they're short of breath at rest, or even wake them up from a sound sleep at nighttime.
All right, how can someone decrease their risk of heart failure?
Sure, that's a great question. So making sure that somebody's blood pressure is well controlled and sticking with a low sodium diet can certainly make a difference in what somebody's lifetime risk of developing heart failure is. According to the American Heart Association in the United States, from the age of 40 onward, one's risk of developing heart failure is 1 out of 5. So people with well-controlled blood pressure have half the risk that somebody with uncontrolled blood pressure has of developing heart failure down the road.
All right, and Doctor, finally, tell us about the heart transplant program at Hartford Hospital. What is the process for receiving a viable heart?
Sure. So our program at Hartford Hospital is well established, having been started back in 1984. We recently hit some major milestones. We transplanted our 500th heart patient this past year, and we're continually evaluating 40 to 50 new transplant evaluations and listings annually. The real success in our program lies in all of our team members, so our APRNs, our PAs, our nurses especially, who make this program work. The process for receiving a heart transplant entails going through a comprehensive evaluation. It may feel long and lengthy, but we want to be thorough and make sure that there's nothing in somebody's past medical history that makes them prohibitively dangerous. And from that point onwards, it's pretty much a tailored evaluation to each individual's unique situation.
All right, Dr. Andrew Scatola, thank you very much for the very latest on all things heart and cardiology. We appreciate your time. Keep up the good work.
Thank you so much for having me.
Thank you.